each of these. Anatomy Center, there's this big long term called pathoanatomical model. That is, if we find something that looks wrong, that must be the reason for the problem. You got back pain, they do an x-ray, you're bone on bone, you got degenerative disc, well therefore that's must be the reason why you're hurting, okay? However, it's to identify what the tissue looks like and is it abnormal, and if it's abnormal, the attempt is to make it look normal. Makes sense, right? Based on that assumption, there's a direct and linear relationship of abnormal appearance and pain. In other words, the uglier the picture, the more pain you must be in. The prettier the picture, it's all in your head if you're hurting, okay? Which is not fair to the patient at all. And it relies heavily on images. All right, so here's a question. Which image would you rather have? Now, you're not doctors or radiologists, right? But you can see, as well as I can, that there's a nice opening here, which is the spinal canal for the cord. And these are bones and discs repetitively down through here. Here's another one with not so open. Lots of black versus black with white in there, which means hydration and separation. Okay, and then you've got things that are bulging out, unlike this side. So which image would you like? The left, of course, unless you learn that the person whose image is on the right was 58 years old, had one previous episode of back pain, which resolved with 5 visits of some exercise and posture therapy. They got back to full function, had no pain with daily activities. They were active and hiking, exercising, traveling, working full time, and they sleep 7 hours a night. The one on the left, 36, struggled with back and leg pain on and off for 6 years. Attempted chiropractic, injections, medication, rest, exercise, posture therapy without success. Discontinued the participation in running, so they had to stop running and cycling. Missed work about 6 or 8 times a year. Had pain awakening them from sleep multiple times each night. Now which image do you want? So just to show you, it's not always the uglier the picture, the sadder the story.